Actually, we have had a lot of issues regarding adoption, even before I'll call it epidemics of adopting students from school, because we've had a lot of problems where children are adopted from their neighborhoods, trafficked to other parts of the country. Though in my department, we have not received any students that were adopted from school per se, but we've received a lot of people that were adopted elsewhere and were brought to us, including children. And we have seen a lot of them present with different degrees of emotional problems, cognitive problems, and social problems. And some may include denial of the events, emotional numbness. Some will be mute, they won't even talk at all. The varying degree of depressive symptoms, which include feeling of hopelessness, feeling of helplessness, even when they are rescued, varying psychological symptoms of anxiety, which will include fearfulness, worrying, thoughts, and anticipation. They are agitated, restless, uh, they have heightened sensitivity to noise, and a lot of other issues. They have all these problems and having trust and trusting other people. And some of them will even go extra length to be even wishing that they are dead, and they even blame themselves, even children.
When they come to you, what kind of help are you offering?
We try to control the immediate emotional problems. Then, when that is achieved, then there is a long-term cognitive therapy we offer, including treatment of diagnosed condition. If somebody has post-traumatic stress disorder, we target at long-term treatment. When somebody has major depression, we target at long-term treatment, and we assure them of the security for subsequent occurrence.
So far, what kind of results have you seen after offering the treatment and the counseling for these children?
Major problem is most of them lost to follow up. When you treat them, when you have like 2, 3 sessions with them, you hardly get them again. Sometimes you have to trace them. You place several passports, most of them don't come back again. Maybe probably because of the financial burden of traveling from where they are to the hospitals or to the place of arrangement. Some of them maybe the cost of purchasing medications if they are diagnosed with any clinical condition that needs treatment.
So there is no funding from the federal or state government for this kind of treatment?
Those that have been adopted in group from schools have some fundings, but those that have sporadic episodes of adoption hardly get any help from the government. If somebody has never experienced this type of situation or is not in the field to see these people or to feel their pain, he may hardly understand. This, I want to tell people that this is seriously devastating. Even to you managing these people, you have to hold on strongly. Sometimes you have to even excuse them, get out of the consultation, weep for these people, hold yourself and come back. It's really painful. It's really devastating. Sorry.
Doctor, do you have a sense that a section of Nigerians are living in fear? Do you have a
Yes,
sense that that is the likely scenario?
seriously, including me. I live in the part of the country where this adoption is frequent, even though the state I live with is relatively secured, but to sleep every day with one eye open. And apart from that, when you are in a work environment or you are a working class, you have this serious fear that somebody is watching you and will likely adopt you someday. We are in constant fear, and we are not sure that the security is enough. So a lot of Nigerians are in this dilemma and frustration.
What kind of treatment or kind of therapy are they receiving?
We treat their anxiety with anxiolytics and based on the National Institute for Clinical Excellence, we treat them with selective serotonin reuptake inhibitors. And psychologically, we give cognitive therapy and cognitive behavioral therapy. There's social treatment. We teach them how to reintegrate into the society, to understand that they are safe. We integrate both the family and the victims together to help them re-socialize again. Then also, we teach them the aspect of positive psychology, aspect of resilience and coping.
What are the parents telling you about their children that some may not openly discuss with you?
For some that their children have been rescued, they blame the government entirely for the insecurity. Some of them blame themselves for not giving their children adequate security. For some that the children have not been rescued, they come with serious problems about what they experience and the fear of the outcome of their children. Those are the major complaints we get from these parents.
Does the country have enough social services to provide counseling for these students?
I would say we are in a country where the people that will offer these services are not adequate. We are in a country with over 200 million people, with a very few number of psychiatrists or people in mental health in general, with less than 200 specialists in mental health. So the workload is too much. So it's just like people that are privileged that will have these services.
Doctor, what are the long-term effects of these kidnappings for Nigerian students and the
Yes.
community?
The long-term effects will include, for older age group, enduring personality change following catastrophic experience, where somebody will have mistrust for the whole of the society, anger for the society, irritability, and in fact social withdrawal. And this, even though is a clinical diagnosis that has to be done after 2 years of the experience or of the symptoms. Then post-traumatic stress disorder, major depression and anxiety, which can be recurrent.
And the question I believe most of them are asking, will they ever recover?
Yes, that's a question they always ask, but it's a very difficult question for every clinician. We can only assure them of getting well in the short term. But we have to be honest with them that the condition has a chronic cost with a lot of occurrences, especially those with anxiety disorders and major depression.
Dr. Haruna, how has this impacted the health sector in Nigeria?
Presently, the Association of Resident Doctors in Nigeria, National Association of Resident Doctors, are even on strike because of a lot of issue with the health sector. So people want to come into these programs. People want to stay in the country to help the country, but the government is not doing well. They are not helping them to solve their immediate problems. So if the government will help with all the demands of these health workers, people will come in and they will be ready to work, and people will be ready to come in to help people with these problems and the country at large.
How has that impacted you as a person?
Many people live in Nigeria to work elsewhere. I already made up my mind. I'll go out, improve on what I'm doing, come back to continue. It's really painful. I want the government to please do something, particularly with security, with the health sector. They should please listen to us. They should feel the pain people are feeling. It's really painful. I have never, no matter the level of physical pain, you never will see somebody in any form of physical pain wishing to die or to commit suicide. But mental pain, emotional pain. It's really painful. Please let them know this. They should employ more people into the security agencies. More, our military is inadequate. They should, our police force, other security, we are grossly inadequate. Encourage them to provide the security. So also, the health sector as well is a mess. They should help us. They should listen to the health personnel so that we have the strength to impact on the lives of these people.